Hey guys, welcome and welcome back to another video. So today's video we are talking about delivery set. I'm going to show you some of the instruments that are in those delivery set or delivery pack. Depends on how you usually call it in your hospital. So this one is mostly for those who are still new in the delivery room or in maternity. You guys, you can get trauma, or your lecturer can traumatize you if you don't know instrument in those the instruments that are in those delivery pack. Most of the time you find that students are being sent, go and bring a delivery pack, but they don't know the instruments which are there. Wait until the time you are doing assessment, and your lecturer tells you to state and explain the functions of those instruments from those delivery pack. It's when you will know that it is always right to know which instruments are in those delivery packs. So today we are going to learn. I'm just going to mention them and give you their function. So make sure you watch this video up to the end. Of course, I'm shooting from the house. I don't have those instruments with me so that I can show you one by one physically. But when I get the opportunity to do that, I will do that. So another thing that you should remember when you are packing or when you are setting delivery pack, remember to pack them into two, so that in case one of them falls down or fall down during the procedure, you don't contaminate the area. You know, our delivery area, or when you're conducting delivery, everything has to be sterile. So yeah, you have to pack them into two or into pairs. You don't pack only one. You, if it is forceps, if it is cord clamp, they have to be two. So yeah, that is what I want to talk about in this video. So stay tuned, watch this video up to the end. So let's look at some of the instruments that are used in the delivery room, and those are instruments in the delivery pack. So we are going to okay, what you have to know, that we have multipara, and primipara. So multipara means that you have given birth more than one time. Multipara means you have given birth more than one times. This is maybe your second delivery, or the third, or the fourth, or the fifth. And primipara means you are first time mom. First time mom, you always write 0, 0. In case you have not aborted any baby, or you have never had any miscarriage, 0 plus 0. You are a first time mom. That is your first pregnancy. Yes, primipara. So when nurses, or when you are arranging the delivery pack, you have to know that there are some things that you don't need in the multipara set, and there are some things that you will add in the primipara set. So let us look at some of the instruments that you will need in the multipara set. So in the multipara set, the first instrument instrument in the delivery set or delivery pack. We have Mayo scissor. And one thing you have to remember is that when you are getting or when you are packing this set, you have to put them in two, so that in case one got contaminated or maybe fall down, you don't contaminate all the set when you're with the reason that you're looking for another instrument. So you have to put them into two pairs, not into two pairs, into two. Yeah, so you have Mayo scissors, the first set, and this one is we are starting with the multi-para set. Yes, multi-para set. So the first scissors is Mayo scissors. I don't know how you call it on your hospital, but Mayo scissors, it's used to cut the umbilical cord. You have to pack them into pairs. The second one, so I'm going to mention them and give them and highlight their functions. So the second one is Kelly clamp. Some of you call them cord clamp, Kelly clamp. We have curved and straight. So Kelly clamp, we have curved and straight. So the curved one is used to clamp the cord towards the baby, and the straight one is used to clamp the cord towards the placenta. Remember, they have to be two, so you have to know there must be two. They are called Kelly clamp or cord clamp, whichever name, so long as you know what you are doing. The second instrument is a rubber suction bulb. Don't worry about my handwriting because you have to rubber suction bulb. Rubber suction bulb is used to sanction oral and nasal secretion after the baby has been born. In case the baby has some secretion, or baby inspires some secretion during the delivery, you use this rubber bulb to do what? To remove the secretions from the nose and the mouth of the baby. Of course, some babies that usually doesn't have some babies during delivery, you get that they aspirate or they drink amniotic fluid and maybe content of conception. So you use that rubber band to remove the secretion. And then after that, we will have several sterile gauze. You put them several, maybe 10, according to your hospital policy. Yeah, some will prefer 10, some will prefer 5. We have sterile gauze. This one you can use to wipe the face of the baby during the process of delivery. You can also use them to wipe the mother after delivery, to maybe if he has tears, or to check inside, or these are just the things that you will use to clean the baby and the mother, and they should be sterile. So according to your hospital policy, some of them usually put them 10, some 5, some 15, according to your hospital policy. We have sterile towel. Sterile towel. Sterile towels are used to you use them to drape the mother. You drape the first thigh and the second thigh. You drape the buttocks of the mother. You drape the abdomen, and also you have one to wipe the baby. So there should be 5. Yes, 5. I think so. So that one, those sterile towels, they should be 5, and they should be used to cover the mother or to drape the mother. That is our language, to drape the mother. And also the midwife will use the remaining one to wipe the baby after delivery. You need to have a pair. You can have 4 pairs of sterile gloves, because you need to put double. You will put them two of them. So 4 pair of sterile gloves. Yeah, and also you will need a Mayo table where all these instruments will be put. Yeah, a Mayo table, or trolley, depends with what or how you call it or how you were taught. So you need a Mayo table where all these instruments will be put. After that, now let us go to multipara, to primipara. We have said primipara is a first time mom. Yeah. So you will still need Mayo scissors, 2 of them, Mayo scissors. I've already explained what they do. You will still need Kelly clamp, the curved one and the straight one. You will still need rubber sanction bulb. Rubber sanction bulb. Another thing that you will also need several gauze. According to your hospital policy, you will need several towels, 5 of them. Sterile towels. Let me just write towels. I will need gloves, sterile gloves. And you will still need Mayo table. Yes. So in addition, because with primipara, we usually suspect of, or we anticipate, or they usually have episiotomy. We are not saying that multipara cannot have episiotomy, but most of primaries usually have episiotomy. Episiotomy is a cut where a midwife, a cut given to someone who is giving birth to increase the space or the way for the baby. Yes, you just increase the vaginal canal so that the baby can pass through, to avoid tears that can cause trauma to the mother also. Yeah. So because most of them usually have episiotomy, we usually have in their delivery set, you must have a mask that is used to cut a suture during episiotomy. You must have a needle holder. Remember, they have to be 2. You must, let me write for you, because when yeah, this one is used to cut sutures during episiotomy. We also have needle holder. From the name, you already know that it's used to hold the needle during the suturing. You will need forceps. Remember, there should be 2 forceps. You will need you need a tissue forceps. You need tissue forceps. This one is for holding tissues when you are suturing, yeah. And you will also need 1 chromic 20 suture. 1 suture, you can put them several of them, but you will need 1 suture. Not the right suture. 1 suture, chromic 20. Yes, it is used to suture ama inatumika kushona episiotomy. And you will need a lidocaine. Lidocaine 2%. This one is to localize the area where you are going to give episiotomy, and after that, when you are suturing the mother, you need this lidocaine or lidocaine or xylocaine, however, depending on the company name or brand name. You need it you need it 5cc or 10cc according to the size of the episiotomy you have given, or the size where you want to cut. So yeah, it is used. This one is used to localize the area where you're going to give episiotomy or during the suturing episiotomy. You will also need a syringe and needles to help you during syringe. This one is for putting this the medicine or the drug, and also needle is for injecting the area or localizing the area. Syringe, syringes and needles. So, still on episiotomy, nurses, sometimes you usually give lidocaine without what? You give episiotomy without localizing the area. It is wrong. It is traumatizing. The mother is in labor, and you know in Kenya we don't give epidural, so the mother has to go through those traumas during delivery, and you are giving what? You are giving episiotomy without localizing the area. That is wrong. Do the right thing that you were taught. Yeah, do the right thing. I know you were taught the right thing, so always do the right thing. Don't give the mother episiotomy without localizing the area, and don't start suturing the mother without localizing the area. So if you're a midwife, this one was for you. If you're a student nurse, this one also was for you. So if you've not subscribed, do it. Like the video, share, comment. Don't forget to turn on notification bell, and let's meet in the next video. Bye.